my name is Maggie. I have an infertility diagnosis due to premature ovarian failure. Today I'm going to talk a bit more about what premature ovarian failure is. So just really simply, it's early menopause. So typically menopause will happen between age 42 and 56. So premature ovarian failure is usually menopause before that age, but really before age 39. It happens to about 1 in 100 women in the ages between 30 and 39, and 1 in 1,000 women of between ages of 15 and 29. So I was diagnosed when I was 17 years old, so that's a less typical case of premature ovarian failure. The main symptom that someone would be able to notice is a period that starts with being irregular and then a period that goes away, or a period, like for me, that never started. So that's the main thing that somebody would notice. Some people also get symptoms more associated with typical menopause symptoms like hot flashes. I've never really experienced something like that. I guess I do get like some hot cold reactions, but that's because that could be related to hypothyroidism too, which is a condition commonly linked with premature ovarian failure. So those are main symptoms that you would be able to see. So if you're noticing irregularity with your period or are not getting a period, that's called amenorrhea. And you'd want to go to your doctor with that if you have a period that hasn't started around age like 15 or 16 or so, or if you had been getting a period and it becomes irregular, something that you'd want to check out with a doctor, because a doctor has to diagnose premature ovarian failure. They do that by doing like checking your hormones through blood work. Your FSH, which is follicle stimulating hormone, would be really high with a premature ovarian failure, and your AMH, which is anti-Mullerian hormone, would be low, among other things. So they would check other hormones as well, but there's other things that could cause period irregularity or lack of period. So you want to go to a doctor to get it checked out for sure. Because with the doctor, even if you did get that premature ovarian failure diagnosis, there's other stuff that the doctor would want to check out along with that, like the hypothyroidism that I mentioned. A lot of people who have premature ovarian failure also have underactive thyroid, so you can be put on thyroid medication for that. And then they'd want to check out for like adrenal syndrome and type 1 diabetes, other autoimmune conditions is what I'm looking for. So that's something that you can go to a specialist for, like an endocrinologist. They'd be able to look more into that. If going to a doctor isn't available for you, there's other sites like Modern Fertility that can help check it out, because they would measure your hormones and your fertility. So you could get more information there, and that's usually less money than a doctor would charge for the same tests. Another good resource if you do get that premature ovarian failure diagnosis is there's this Reddit group I'm in. It's called POF Life. I'll link it below. But the person who runs that Reddit has a lot of good resources, including finding a doctor, because some doctors just aren't as knowledgeable with it, or aren't that supportive with it either. So it's a good idea to have a doctor who is knowledgeable with it, being that it is a less common condition. So there's a whole list on there. So I'll link that site below. I'll also link the Resolve site for fertility below, because that has more information relating to infertility and then also premature or ovarian failure in general. But I think it can be a scary diagnosis to get, obviously, because there's not really treatment available for it. Like I've talked about the clinical trial, and then Resolve mentions some things that the doctors can do, but it's really not much. But I think getting the diagnosis and knowing that is good information to know, and then also being able to be on the lookout for those other conditions that may be affected by it. But what I've noticed from the POF Life group is that there's a lot of people who think that they have premature ovarian failure and get really freaked out, but that might not be necessary. So I think getting that straight diagnosis is really important, just because that will help calm any anxieties or fears, is just having the information and being able to move forward from there. So as far as support for it, Resolve has that, POF Life has that on Reddit, whichever you like to use, or if you have any questions or want to talk with me, please feel free to reach out. I have my email on my YouTube, you can comment, or you can DM me on Instagram, whatever works for you. If you enjoy my videos, please feel free to like, comment, and subscribe. Thank you.